In the shadows of the coronavirus pandemic, a mental health crisis is looming in the workplace. That's according to Professor Renata Skuman. She's the head of the MBA Healthcare Leadership Program at Stellenbosch University. To discuss this further, Professor Skuman joins us live now via Zoom. Professor, thank you so much for your time. You've said that navigating the aftermath of COVID-19 is one of the biggest challenges that businesses are going to face. Expand on that. Why do you say so?
So during the pandemic, there was all kinds of challenges we had to face. There was the losses in terms of health, in terms of income, in terms of loved ones that you had maybe that died due to infection. But there was also other challenges. We had to get used to work from home, technological challenges, homeschooling, etc. But not just as people really settled into this routine, paired with the ability maybe to take better care of themselves because they didn't have to commute, they had time to exercise, etc. Now we're back at work. There's a lot of uncertainty for employees. Do I need to go back every day? Will I have flexibility? Longer commute times again? And then also some might be really, really scared in terms of the protective measures at the workplace to deal with ongoing infections. And it's crucial that employers now recognize that employees might experience this distress. And in the recently published Mental State of the World report, it has been shown that already South Africa sits with 36% of people being very distressed. Now, that doesn't pertain specifically only to diagnosed medical conditions, which we know has incrementally increased over the past 2 years in terms of anxiety and depression. So employers will have to see what they can do in terms of to make sure that their employees are secure, are safe from a psychological perspective, and also that they remain productive when at work.
What are the tips that you have for return to work strategies that promote good mental health, that make employees returning feel safe?
Definitely information. So information in terms of what will be the procedures, the operating principles, etc. How many days a week should I be there? Do I have flexi time? Can I work certain days from home? I think that is step one. Step two, also, what is the safety mechanisms at work? Is there mandatory vaccine policies? Are there masking? Are there some sanitation? Do we have social distancing? But one of the big challenges, and where we really need to be creative and future-minded, is to look at how do we measure productivity. Are we going to see an employee as being productive because there's a seat in the bum behind the computer? Or are we going to start to measure outputs and reward people for being effective and efficient? The third thing is really to address mental health stigma in the workplace. And for me, that's obviously one of the most important parts. Have the conversations, but also have a safe and supportive environment of how we can support people both at work, but also to refer them when needed, and how we can afford them that flexibility also to access mental health services should they need to.
How do you go about reducing that stigma, Professor? And I know, like, for a lot of people, culturally, it might not be something that's spoken about. Some people might not identify or empathize with people's mental health issues because, you know, they were brought up in a household where you're told to just tough it out. How do you then help break that stigma?
I think the very, very first thing is really education, and the media is crucial in that. Media campaigns, but also having interviews, even like just this morning where you afford this opportunity for us to talk about it, where you can normalize mental illness, where you can make people more aware of the symptoms that you might be struggling with. Many people struggle, for example, with chronic fatigue or constant headaches or really losing interest and drive, feeling sad, negative feelings, but they don't realize that it might be depression, which is a treatable condition. So the first basic thing is absolutely information and education. And the second thing is then, if someone is identified, how do we go about? Is reasonable accommodation the answer? Or do we tend to jump the gun straight to, oh, it must be someone that's not be able to work or someone that needs to be admitted? Because that is often not the case. If employers can create the supportive environments, we can keep people productive at work. And I think many people are scared of mental health conditions because they don't really understand it. If we have changes in our sleeping pattern, it might indicate a problem. Yet we speak freely about that. but we're not speaking freely about a depressed mood, for example. And it's crucial that people need to start to look at mental health conditions as they look at physical conditions like hypertension or a fractured leg or diabetes, etc.
What do I do as an employee if my employer is not doing anything to help me mental health-wise? Sometimes you're powerless.
Yeah, it's sad. It is the case in certain organizations. I think organizations is really starting to join the conversation. The first thing is there's two ways. The one is the organizational route where you might have to approach human resources and speak to someone there. But then there's also the mental health route, which is crucial that if you see some of these challenges in yourself, that you do seek professional advice, whether it's from a psychologist or a psychiatrist or even your general practitioner. The person in the multidisciplinary team dealing with mental health disorders that's best positioned, most likely to have the conversation with the employer then, is when the psychologist or psychiatrist can refer you to an occupational therapist, which can really upskill you in practical changes that you can do at work, but also have the conversation with your employer, with your permission, obviously, in terms of what reasonable accommodations is possible at work. For example, flexi time, or maybe if you're very anxious, not having to do presentations for a period of time, or whatever is reasonable underneath the Employment Equity Act.
All right, Professor, thank you so much for joining us. We appreciate it. Professor Renata Skuman, head of the MBA in Healthcare Leadership at Stellenbosch University.